It is around 5:30 a.m. I just got dressed and about to head to the hospital. Today, essentially, I have a surgery that is scheduled at 7 a.m. this morning. It's a lumbar disc replacement. Just means patient who has degenerative arthritis of their lumbar spine. We will go in and place a artificial disc, and essentially this is a disc replacement in the lumbar spine. And here at this fellowship program, this is the place where they do the most of them. This is where it first started, so it's a good opportunity to learn from surgeons who have been doing this for 20 plus years. And then after the first case, I will be heading to clinic with another surgeon for the remainder of the day. So just one surgery today. I'm actually covering for another person who is out this morning. I was supposed to be in clinic all day today, but I'll do this case. The case should take about 2 hours, and then I'll head to clinic. Usually in the morning, I get up, get dressed, brush my teeth, and throw my scrubs on, and then make sure that I have my green drink. So I need to shake it up, but my wife makes these for me, and trying to be more healthy and eat things that are more healthier, especially as I get busier. I think that's important. And also, big jug of water. And I'll take this and drink it throughout the day today. But yeah, should be a good day today, and you guys will see a little bit of what it's like to be a spine fellow. We're about to do a disc herniation, a discectomy, which we go in and remove the herniated disc. This gentleman has been having leg and back pain for over a year. So surgery should take about an hour and a half, 2 hours. All right, here we go. So surgery took about an hour and a half. I actually thought we had a lumbar arthroplasty, which is a disc replacement in the spine, but I guess I read the schedule wrong. The first case was a lumbar discectomy, which means we're going in and relieving pressure on a particular nerve. So in between the bones in your spines, you have what's called an intervertebral disc. And sometimes these discs, from either injury or old age, and they usually dry out, they're made of a lot of water. This disc can extrude, and when it extrudes, it can press on a nerve root. So in the spine here, there's different portions of the spine. You have your cervical spine here, thoracic spine, and then your lumbar spine is right here. We usually make an incision on the posterior portion of the back, right over these bones here called the spinous processes. We go down, and then we remove some bone here to get access to that nerve and also the disc. So the disc is this little cushion here that's between the two bones. When this either dries out or you have an injury to that particular disc, it can press on that nerve that comes out right here. So depending on that nerve's particular function, that is what will result in terms of the pain or weakness or inability to utilize that particular portion of the body. So if it affects the L5 nerve root, which is right here, and this is on the right side of the body here, the patient can have weakness in their EHL, the extensor hallucis longus, or their gluteus medius muscle, which we can pick that up on exam. So we go in, if there's a disc herniation present right there on that nerve, we go in and relieve that herniation, but we approach it from the posterior portion of the spine. But usually also between cases, I usually put in orders for patients. Their medication orders, I'll admit them to the hospital, order any imaging studies if we need it, give them antibiotics. Usually we give patients antibiotics after surgery for 24 hours or longer. And then you have to put in orders for the nurses to carry out those orders, and they have to be very clear in terms of what you want that patient to do or to not do. You want them to work with physical therapy, you want them to stay in bed, do you need them to be on bed rest, or do you need them to work with occupational therapy, get x-rays tomorrow, give this medication at this time. So we put those in the computer for the nurses to carry out. Usually I have about 15 or 20 minutes between cases to do the orders, grab something to eat real quick, use the bathroom, and then by that time the turnover of the room is usually complete. Turnover is the time that it takes from the completion of one case to the start of another case. And some hospitals, this turnover can be an hour or hour and a half, and here they're pretty efficient, so turnover is less than 20 minutes, which is crazy. Just had this one case today, and then in the rest of the day I'll be spending time in clinic. And clinic is where we see patients that are either new patients or old patients, or what we call consultation visits. And this is when a patient who has a spinal cord injury or a disc herniation or back pain, scoliosis, problems with their neck, any type of cervical, thoracic, lumbar, sacral injury or problem, we see them inpatient. We do a very thorough exam to try to figure out what portion of the spine is affected. And then we order diagnostic tests like an MRI, a CT scan, x-rays, EMGs, which are electrical muscle tests to test the muscles and see where there's a problem with the nerve and the muscle. And then after that, we determine whether they need non-operative treatment, which could consist of injections, physical therapy, sometimes chiropractors, and then possibly surgery. So we try to utilize surgery only as a last resort option, but sometimes patients need to go to surgery right away. And yeah, so clinic, we should probably have about 20-25 patients for the rest of the day to see. And then after clinic, we're actually going to a movie premiere. There's a movie that is coming out. It's called the Brian Banks movie. This is a gentleman that was exonerated. He was wrongfully convicted of a crime a number of years ago for something that he did not do. And it's a true story, a very inspiring movie and story by a gentleman that I've come across on social media, and we've connected, and there's a movie premiere tonight about this particular gentleman. There's going to be a guest speaker there who's going to be hosting the event. He's a person that I'm pretty sure you guys will definitely recognize, so stay tuned to the end of the video and you'll see who that is. But yeah, just about to head to clinic, and then after clinic we'll go to this premiere. I'll try to get home to try to prepare for surgeries and cases tomorrow. We'll see you soon. So we're here at the Brian Banks movie premiere. He's a gentleman that was wrongfully convicted of a crime. Premiere is here tonight, so I suggest everyone go out and check it out at the theater.
Mr. Deion Sanders.
I'm appreciative that we were chosen to really debut and preview this wonderful film. It's a story that has a lot of life lessons, has a lot of lessons about endurance, overcoming overcoming adversity, and it's something that we all desire to be. Football star headed in the right direction on his way to USC. Then got accused of rape and spent a multitude of time trying to get himself exonerated, and he did such a thing. And this is a tremendous story.
I'll bring the full team out here.
Thank God we did it successfully.
So we're just now leaving the premiere of the Brian Banks movie. Definitely an inspiring movie that tells you and shows you that life, it's not about what happens in life, it's about what or how you react to that particular aspect of your life. So definitely check it out. It's coming out in theaters August 9th. Alright, so we just got home from the movie premiere. Definitely check out this movie. It's a really inspirational one, and one that I think that everyone should see. So thank you guys for hanging along with me over the last day in the life of a spine fellow. I hope you enjoyed it, and I look forward to making the next one. We'll see you next time.